I actually think the kids are doing better than us.
Well,
because like my 8-year-old, they're coming up into this world, so it became normal to them. Over the summer, it doesn't bother him at all.
It got to a point, Carly wasn't getting out the car without a mask on. She like, Corona and we gotta get our mask. You know what I'm saying? She don't know nothing about it, but she know, look, I ain't getting out of here without that mask on. Right.
So with woke culture, are you seeing a resistance towards traditional healthcare? And what I mean by that, you see a lot of science, natural science, healing type things that's being pushed out to the culture. I think Dr. Sebi, I don't know if you're familiar with him, but very popular in our culture. That a lot of people are mimicking that since he's passed. But are you seeing that? Are you seeing a pushback from it, or?
A lot of my population is much older because they're homebound. I see people who can't. So I don't see that as much. I don't have a lot of, now, probably my colleagues who maybe work in the primary care clinics where they're younger veterans, I'm sure they probably see that a lot. But me, out of all the people I service, I think I have 2 that are like that, that are their exact words, I want no Western medicine. They won't even take Tylenol.
What's the benefit? I mean, is it a benefit from doing it that way? And because I'm kind of like that. I understand.
I think it's both though, because our parents, there were things that they did,
right?
You know, years ago that worked. But the natural remedies, I think it's a balance there, to where it's some that could be effective, but just like you said earlier, in moderation for the individuals that. There's nothing natural that I know that will treat cancer. You know, some things that you're just going to have to go conventional if you're going to.
They say weed doing a pretty good job.
I agree.
So my thinking with that is, I'm the type of provider, I try to prescribe the least amount of medicine possible. Now, so if somebody come in, say they have high blood pressure, I'm not going to give them medicine the first time. That, like, even going out to their home now. If I go out to somebody's home and the first time I see them, their blood pressure, I'm not gonna give them a pill that day.
They could have been just stressed out.
Right. I'm gonna say, okay, are you sleeping? Are you eating a lot of salt? You know, ask for all these things. Okay, I want you to work on your modifiable risk factors. These are the things that you can change. Are you a smoker? Okay, I need you, if you're not gonna quit smoking, don't smoke an hour before I get here, because your blood pressure is gonna be through the roof.
Right.
But that's just the way cigarettes work.
Taught you something.
Yeah, if you're a smoker, do not smoke 1 to 2 hours before going to the doctor, because your blood pressure is gonna be high. That's just how. That's just how that works. And I'm gonna stand back in 4 weeks. Okay, if your pressure is high now, I'm gonna put you on a little something, see how you do. If you do well, then hey, maybe you need that medicine. Or if I come back and it's lower than it was before, maybe you didn't need it. You just need to change some stuff. So every situation is different.
I think everybody has that fear that once you saw how he reacted when I said he was on medication. So everybody's so afraid that once you're placed on it, that's a lot.
No, that's not the case.
Though. Like if you think about
it, did they change their lifestyle though? If the actions continue, then yeah.
What I'm saying is, think about it. Like when you seen Big Mama and them back in the day with them pills. And that Monday through Friday thing, it's about over.
Do they keep either?
What you said about over?
I'm saying now, you.
Cause I ain't know.
Keep it. I
didn't know why my big mama was taking them, but she was taking them. She was popping them.
But that's what I'm saying though. You look at them pills and like, honestly though, I just thought it was a part of getting old. So I didn't look at it as scary. Like I thought, you live with. I just thought you just. I ain't gonna lie.
I know you can be healthy and being old, but I'm saying I associated with that growing up. I associate with it. What you got to do once you get a certain age.
But it's because back to what he said though, because my folks, they didn't take them till then though. Like when they started taking medicine, it was a couple years, like a few years maybe, but it was that because my granddaddy didn't take. I don't remember seeing him take an aspirin or anything. Grandma same way, and so when they started taking it.
Right.
It was like you seen them, and then
I didn't have that same experience.
So to me, it's like Man, I don't want no. If I can do anything other than take medicine, just tell me. Like that's what I asked her when she told me about my vitamin D and I'm like, what else can I do to not take the medicine?
Gotcha.
And she was like, well, you can drink milk and all this type of thing. So give me something else. Can I work out? Can I do more of this? And so.
But see, the thing you remember you just said about how you noticed once they started taking the pills, it went long. But how long before they started taking the pills was whatever they had going on? How long had it been going on?
It probably been going on.
Right. And so that could be why.
Yeah. And you're right. You're right. I ain't never thought about it like that, but you're absolutely right.
I think you can definitely see the difference. I don't have stats in front of me, but it seems like the older generation held up longer.
Food,
they had more
food.
You think it's the food?
I think that's a big part of it. I think food is
everything.
Right. Well, it's other things too. You got to look at it. When you spoke about your grandfather, he was outside every day, right?
Right. That too.
We work office jobs to work vitamin D things. So he's outside. He's getting his vitamin D. He's active on the job to where most of us are not nearly as active as they were.
Here's the thing though, like they talk about the pork, which is bad, pork bad. Man, they ate pork all their life and they lived a long time. Folks ain't even living that long no more.
That's true.
That's true.
Like, so it gotta be something in the food that ain't right. Am I right?
I think there are a lot of like hormones and things like that definitely affect, like even development and growth and all that stuff. I definitely think that's a part of it. But I think I'm put my Malia in here, pollution. Because Malia real big on pollution. I think that plays a part in it. We're driving in cars all day long.
Right.
We're not, like you said, outside.
Yeah. It's just something about when you see a chicken chest big as mine, bro.
Which is true. So they have to put them out at a greater rate now. So they're growing them faster. Like these are natural chicken running around like my grandmama had.
World, man. Everybody have a burger joint.
Right.
I don't care what nobody say, bro.
Right.
But even when you think about that, think about if you decide today, okay, I'm going to go healthy, I'm going to go natural because it's better, right? Mm-hmm. The price is so expensive.
It costs more, right?
The reason, one of the reasons why I think people eat fast food is because of the convenience.
It's cheap and quick.
And it's cheaper.
Cheap and quick.
And it's,
why is that though? Why is the good stuff so high and the bad stuff?
Because
quality.
It takes longer, right? It takes longer to prepare this. Like
and they can do more. When you got a chicken that you can go from a baby
about 4 to 6 weeks, whatever.
Weeks. With hormones, that's pretty much what you have.
And at the top of it is capital. Like that's it.
But they are.
So in a COVID world, what should we be doing to prepare ourselves? Because right now we don't have a vaccine. I would imagine once the vaccine comes out, it's going to be a lot of people that will be skeptical, myself included, for a while, right? And so I think, from my perspective, I think the best defense is being offensive or being proactive to try to minimize. So my strategy is to be one of the last ones to get it.
Mine too.
For everybody else to go ahead and get the vaccine, and I'm watching everybody else. I'm not coming off the bench to the 4-4.
Yeah, and I'm coming off after you.
And overtime.
I'm gonna be post game.
And particularly, the last couple of weeks we just started up school, and so it makes the social distancing difficult.
Very
have to worry about, again, I wouldn't call it mental health with kids, but they are getting antsy because they desire contact. They want to
get outside.
Yeah. That was a struggle.
Yeah. So, in your opinion, what's the strategy? Because we're not getting strategy from anywhere else. We're not getting it from a lot from state and national officials. And if we do, it's distorted before it gets to us. What do we need to do?
So my big thing is I just been telling everybody, wear your mask. If you can, stay 6 feet from the next person. Wash your hands a lot. If you don't have to go, don't go. Now, I'm going to speak on the children in school. So I have a teenage daughter. So when COVID first hit, no, you're not going anywhere. Nobody can come over here. Like, it's just not happening.
We locked it down. Everybody did.
Like, and she's a little social butterfly. So she had a hard time. Like, she had a really, really hard time. And so when they got ready to open back up the school with the staggered schedule, people were like, what are you going to do? I mean, you in healthcare. You going to let her go? And my thing was her mental health at that point. She needed
she
her
needed to go.
friends. And she had been around me enough and hearing me preach about your mask and preach about staying her distance. That she did pretty good.
Right.
We hadn't had any issues. But I think the big thing is if everybody follows the mandates, wearing a mask, staying 6 feet from the next person. Now I heard somebody say, "Well, why is it 6 feet?" So just a little medical background. COVID is droplet, so that means it's transmitted through droplet, through respiratory droplet. So coughing, sneezing. So if you're closer than 6 feet to the next person in distance, you're more likely to come into contact with it. So that's where the 6 feet comes from.
Right.
Wearing your mask, washing your hands, disinfecting commonly touched areas, so like doorknobs, light switches. Go through your house, and I get it. It may be hard to do it every day, but at least every few days go through. Spray down all your doorknobs, spray down all your light switches. If you have any type of immune disorders or any type of underlying conditions like diabetes, hypertension, I've been advising people again, if you don't have to go, don't go. And if you do have to go, don't stay long. Because that way you're going to minimize your likelihood of coming into contact with it. Because we don't know where it is. That's the thing. Like, you don't know where it is. It's not like when you touch a doorknob, it's got a little sensor on it that says, "Oh, I have COVID on me." You don't know.
Right.
So,
That beach trip counts.
True.
Ain't no beach trip.
Well, wouldn't the beach be one of the safest places though?
You trying to get that beat?
No.
So this is what I tell people. I don't recommend anybody just like stopping doing everything that they, if your beach trip is something that's good for your mental health, and you look forward to that every year, okay, no, you can't be going to all the different eateries that you maybe went, but as far as, hey, I'm gonna go to the beach with my friends or whatever the case may be, when we on the beach, we're gonna be separated. I'm gonna make sure I'm disinfecting surfaces. My biggest concern with the beach is that so many people are there and they're touching so many things. And you don't know where it is.
You cannot disinfect sand.
Yeah.
Right.
You don't know.
But it can't travel in sand though, right?
If you step on it.
If you
can't go there.
Nah, a shoe. Okay, I get a shoe because that's a certain. But sand?
Can't go.
I don't know if my droplet can survive in the sand. But now everything else around under bottles and whatever else, I get it. Them umbrellas, chairs.
And I want to.
Maybe.
I ain't been. I want to go to.
I don't know. It seems like to me the beach would be safer than a restaurant.
Yeah. So if you're out in the open, it's always going to be better than enclosed.
And the beach is huge. But you can't get too many people in that space also. But I'm just saying, like, it seems like they would be less likely or a little bit more safer. Not safe all the way, but a little bit more safer.
And I mean, the other thing is too, just COVID is a contagious illness. So keeping your distance from the next person, that's gonna be one of the biggest things that's gonna help us out.
Is there anything that you can do that determine how bad you get it? Because I done heard of some cases where people get it and you don't know you have it, and then you have some cases where people just bottom out. Like, is it anything you can do that if I do get it, is it being healthy a good thing? I mean,
I've had people who were healthy, ran every day, natural, eat organic, all that stuff, pass away. End up on an event and pass away.
That's the part that concerns me.
I had a colleague that said it made so much sense to me. She said every patient that comes in here is almost like a case study because it's so new.
Yeah, different
because
people.
For example, you remember when they first came out with the symptoms, loss of taste and loss of smell was not a symptom.
Right.
And then they came back like, oh, all these people saying they can't taste or smell. So it's just so new.
Does a virus evolve?
What you mean?
Like, are there different strains?
I heard
that.
I heard that
like, have you ever heard somebody say like I had flu A versus flu B?
Right.
Yeah. So there can be different strains. I have not seen where they've studied that with COVID though.
It's so early they probably won't know.
So this man-made this something that just came out.
No, it's not. Initially, now when it first came out, supposedly it was made in a lab in China somewhere, but that theory was disregarded.
Okay.
So they proved that was not the case.
So gotta keep wearing a mask.
Yeah.
Gotta stay.
Just keep wearing
See,
your
the
mask. Wash
concerning
your
thing about
hands.
that is when it first happened, we would have never done this. The first 3 months we would have never did this. I think I may have went 5 months without seeing you.
Yeah.
Because
this joker here.
Hey, yeah.
He ain't listen.
I just asked the beach question. I'm not in the beach. I'm not nowhere.
I seen Darrell when we shot the last time.
That's it.
That was my first time seeing.
I don't
Darrell
go nowhere.
since then.
I don't go nowhere.
Yeah. I minimize moves. Some things you can't help. You got to work.
Yeah.
Right.
We got to work.
Right.
That's
gotta
all I
move.
do. Yeah.
And
I
you
had
got
to
to
do that.
have some sense of normalcy. We just can't shut in forever on it. But
You gotta learn to live with it. I think is a
for a while.
Modification.
yeah.
You gotta
Is a
modify.
thing. Cause that's like you were talking about your daughter, like Carly, like her going to daycare at first was. I mean, like you know how Hope is, you know. So we.
I actually think the kids are doing better than us.
Well, this
because
the thing.
like my 8-year-old, they're coming up into this world, so it became normal to them.
The way
Over
put
the
on the
summer,
mask.
it doesn't bother him at all. To have
It
them.
got to a point.
Yeah.
Carly wasn't getting out the car without a mask on. She like Corona and we gotta get our mask. You know what I'm saying? She don't know nothing about it, but she know. Look, I ain't getting out of here without that mask on.
This is something we kind of touched on earlier, but I also feel like it seems strange to me that kids these days with social media, like you can talk to your friend, you can FaceTime, you can do all this. It almost seems like why are you having such a hard time into not going to school or going to this party, your homegirl party? Because you can see your friend when coming up. We couldn't see each other.
You talked on the phone.
You had to go over there and go outside and do all that. It
Three-way.
Seemed kind of hard that they having to,
Because it was a full stop for them.
And
For us, that's the way we came up. But for them,
Right.
they just started.
but we could see our friend. Like I ain't got to go to Pounce's house. I can call you on your
Call
phone
them,
and look at you, and we could do
Like,
whatever.
we still socializing.
we still
face-
could-
you know what I'm
It
saying?
seems like that would make it easier for them to deal with this social. Not saying that it has, but it seems like it would.
And I
Be.
think it's one of these things where, with everybody, it's one thing, and Malia even told me this, and it made so much sense to me after she said it. It's one thing for you to tell me I can't do it.
I think that's amazing.
It's
then-
another thing for me to have the option to do it
Yeah.
and not do it.
Yeah, just like
Yeah.
it's my right not to wear the mask with some of these people, you know.
Right.
Oh,
Yeah.
you taking
you
away my
you
right?
see a lot of people that's having
Yeah.
a serious
Yeah.
issue.
You
with
taking
it.
away my right.
Stupid. It's stupid.
I don't understand that either.
Not putting on the mask is just listen. It's a mask, man. Like ain't nobody telling you to give nothing up. You
Right.
just putting on the mask.
Going
and
against
doing
their
what-
rights. I heard that.
Yeah, I had
okay.
a friend
Okay.
that said something. It said a lot of certain people have always had to follow rules. So when they said put a mask on,
Right. Okay.
Big
a
deal.
mask got put
Right.
on.
Is that a
Other
mental health issue?
cultures have not had to always
Is it
follow
what?
rules.
Is that a mental health issue? I'm just asking. Is that a mental health issue?
It's a
What
form of
I
PTSD.
think it is, I think it's an excuse for being selfish.
I think you're judging these people. I think they're having mental health issues.
No, I
and
don't think so.
I think it's something that they need to sit on the sofa with and talk to somebody about because obviously this mask is doing something to them.
But you know, something else I've seen a lot when people ask me questions. A lot of people are doing a whole lot of Google doctoring. They looking
Yeah.
on Google, Facebook, getting all these crazy
Ideas,
ideas
yeah.
about what COVID is, how to cure COVID, and all
And the
this stuff.
subject matter experts, right? After a day of studying Google.
Yes.
And you know what? And that's important for like especially our culture because you know we don't go to the doctor like me and you were talking. It's about 4 years ago. You couldn't get us. You couldn't drag us in there because we were sick.
Awful.
And so I think that's good for our culture to start understanding that you gotta get to the doctor. Like having you is one of the best things we could have ever. You know what I'm saying? Because we can actually pick up the phone and call somebody that know what they talking about.
You have to get somebody that you can trust.
Right,
And sometimes
right.
it's outside of the profession where if you have that person that you can call and double check, and
Yeah.
most of us hadn't had access to that, and
Right,
so
right.
that's why we're skeptical of the healthcare
Yeah.
system for so long.
But you got to get in there. Ain't no doubt about it. I'm a believer now that you got to go to the doctor. You know.
Medication.
I need because this thing been coming up in questions I don't know about that colon thing. About,
Colon?
yeah, when you supposed to get these colonoscopy. I need to know.
Is the
that. I
colon?
need-
Is that prostate? That's what you worry about.
pro-
It's the prostate.
Whatever you got to get checked. You know what I'm talking about?
Well,
What's
you
the
know-
age limit on this thing? I'm getting up there.
African American men really should start at 40. Because you're more likely. That's what your doctor's want to
Fine.
You want. That's what they
Fine.
told you. You want to confirm it. Then yep, 40 because.
And if your father had it,
Yeah,
you're
and-
like a 90 percentile.
My father didn't have it. Nothing I
How you
knew
know?
of. He didn't tell me.
But yeah, African American men are more likely to develop prostate cancer. So 40. And now there are other options. You know, you can get blood work.
Oh, so you can do that now?
You
Yeah.
can, you can do blood
What?
work. Yeah.
So you ain't got, did you know that?
Yeah. I was just gonna let you do it.
The traditional way. You're gonna do the traditional way.
I want to go see you.
Yeah.
Ain't nobody gonna tell me.
Yeah.
I'm glad I ain't there yet.
Hey,
I actually looked it up.
Jesus
Yep,
Christ.
they
they
can
can
check
do it
us.
through-
They
I
can check
figured
us.
they would come up with something different after all this technology and stuff came out.
Oh, yeah.
Well, I got a personal question. So my pop, he died of aneurysm. Is that hereditary?
So it depends what caused it. There could be
underlying
hereditary, a
issue.
genetic factor there.
Ooh.
So depending on what type he had, you just want to talk to your healthcare provider. Depending on what type of aneurysm, they could just do a CAT scan on you every few years just to make sure you don't have anything.
Wow. So you can possibly see that it's headed towards the aneurysm, like whatever.
If you have one, because usually they start small, but the thing is people don't realize a lot of times what I see is they don't even realize they have it until they have really bad symptoms or they, had a full-blown aneurysm and pass out and all this type of stuff. But if you have a family history, she may say, or whoever your doctor is may say, okay, we're going to check a CAT scan or imaging on you every so many years.
Right.
So if it is hereditary, I guess I'm in trouble because I had an uncle that passed from an aneurysm. I had another uncle that had an aneurysm, but he lived because they got him in time to the hospital. So he lived a long time after that.
It just depends what caused it. That's the thing. Like if there's a genetic factor, say someone has an aneurysm that's directly related to hypertension. That's a genetic.
Keep bringing up hypertension. We got to talk about that after you finish this question.
Because I'm real big on healthcare that, I guess, how can I say this? Where African Americans are disproportionately affected. And hypertension, I just see so many things that we have to deal with related to hypertension on a regular basis. So that's kind of near and dear
Hey,
to
you
me.
just gotta follow the rules, man.
But
Third time she brought it up.
Yeah, and we're definitely at a higher risk for hypertension also, right?
Hypertension, diabetes, stroke, certain kinds of cancers, kidney disease. That's why when you go to the doctor, I don't know if you ever paid attention to your lab work, that there's a lab called a GFR. There's always two of those. One is if you're African American, and another is if you're non-African American.
Wow.
Because we're more likely.
So what can we do to improve that? We know eating and stuff for the diet, but what are some other things that we can do to improve?
So diet, activity level, like 30 minutes 3 times a week. I don't do that, but I do recommend it.
That's the base. That's the baseline, right?
Yeah.
You said activity? You said
him
activity?
Yeah, activity level. So 30 minutes, 3 times a week. You want to try to maintain a healthy weight, so you do that with diet and exercise. If your doctor does prescribe medication, I strongly recommend you comply. If you are a smoker, I say no to that. What else?
Drinkers? What about drinkers?
Drinking is okay.
Don't let him off the hook.
Men, 2 a day. Is the
2 a
max.
day?
So you
Two.
Oh, yeah.
Women,
No.
no,
Listen.
no,
What's 2?
Let me tell you about this guy.
no.
Let me tell you about this guy here. P don't like to take the bag off his ball, so you don't know how deep he don't went in.
It's somebody in my house drinking. It ain't me. Somebody in my house
I believe
is
it.
drinking.
Right. I know somebody that may drink more than 2 a day. So what should I recommend they do? Not drink? How
Stop
many?
drinking that minute.
Yeah. But I will say this: if that whoever the person you know,
Right.
if they have been doing that for a very long time, you do not want to stop that cold turkey because then you might have it.
Withdrawals?
You have. So
key,
you
yeah,
want to. It
withdrawals,
can.
yeah.
So you want to.
It's got to be real bad though to have withdrawals.
Yeah,
though,
that's
right?
if you. That's
Yeah.
what I said. If it's somebody.
It's probably real bad.
Oh, no. No way.
You know.
Yeah, you
See,
want to.
Here's another recommendation I would make for that person. Test it. Go a couple of days and then go back. But that's on anything. If you worried about having an addiction on anything, just stop it for a minute and see if there's any effect. Because I long time ago, I would check that stuff to see do I have an issue. Go a couple of days.
You
see if
definitely had
you
the
okay.
issue in college.
What's that?
You definitely had the issue.
Not
in
really
college.
though. If I can leave and go 2 weeks or go a month, I didn't have a problem.
Yeah.
You didn't go. You came.
I
to my
just
room
enjoyed it.
every morning, bro. Every morning.
That's because I could.
That's an addiction.
I didn't have a problem. I had an opportunity.
Man, if you
And I was taking it.
Listen, if you drinking at 8 o'clock in the morning, you got a problem.
Yeah. Had you, before breakfast or after?
Ain't no breakfast involved.
He exaggerated a little bit. The store they didn't open till 11. I went to get
Then
him
that
at 8.
mean
I went to get
you
him
know what
at
that
8.
mean, right? That means he bought more than one bottle when he went in there. He had a bottle for the next day.
Oh man, that's crazy.
Well, this was good.
We told you it was gonna
enjoyed
go
it.
by quick, didn't it?
It did.
So no, you're not done yet. So if you were Surgeon General for the day, this is my final question. Surgeon General for the day. Let's just say for the state of Alabama. What would be your recommendations for the priorities of the African American community health issues to be addressed?
Ooh. Mental health would be at the top because I think there's such a stigma in the African American community related to mental health, and I think that because of that, oftentimes we don't get the treatment that we need. So I think that I would advocate for more mental health centers, especially in rural areas. One of my other big things would be, which I guess it could still be health, ensuring there's adequate options for school-age children as far as food, some type of program. I know a lot of schools have it where they can, take food home in a backpack for the weekend and things like that, but I would want to make sure that that's available to every child. Like those would be the things that I would really want to focus on.
And to make sure that we're well represented. I know it's all guys that's talking, but we're all married men also. So we get to see the issues that our females have. Is it anything particular to the African American female that you would like to address?
Something which I do nothing with OBGYN or peds. I ran from those in nursing school, but I have been seeing a lot of stuff in the news. I've been reading articles about African American women and the alarming rate that we're dying during childbirth. So I would definitely want some type of expert or some type of research focused on that, because I'm seeing that happen a lot. Just a week ago here in Birmingham, I think the young lady was like 19.
Wow.
Died in childbirth, or complications from childbirth shortly thereafter. So I when I do get like the articles and I read them, I've been seeing that a lot, and that's concerning. That's very concerning.
And stop stressing your significant other out. That's probably a big one, ain't it?
What?
No, I'm
Like
talking about
y'all stress us out?
Huh? I mean, either
It's the
or.
reason why we die younger.
Well, yeah, it's PTSD, from all that stuff we've been through and seen.
Nah, I'm just figuratively speaking.
And
My
we didn't
wife
get
is
group
fine.
counseling
She
before.
didn't stress me out at all. I mean, it's perfect. I don't have those issues. I'm just speaking for other guys out there in the world.
No, if anything, we're the greatest. Like
Y'all got a hard job, ain't no doubt about it. Y'all got a hard job.
I got a question. It's mental health. Your regular insurance cover that?
And depending on where you work, you want to check, because a lot of companies have what's called EAP, Employee Assistance Programs. And so if you have issues related to mental health, a lot of times if you need to take time off and things like that, you're covered, you're protected. So I encourage people to do that. Like look into that. But yeah, mental health, like health insurance covers mental health. Depending on what type you have, of course. But yeah, most of the time it does.
Because that point, you'll be going to see a counselor. Like, just say you want to go in, right, for mental health, whatever. You don't have no issue that you know of, but you want to go converse with somebody about mental health. You go into that's not a regular.
That's not a psychiatrist.
That's a what would you?
A therapist.
A therapist,
or a counselor.
right?
Yeah, you can. And the difference between that, I've heard that question before. The difference between a psychologist and a psychiatrist. A psychologist treats without medication, so they don't prescribe any type of medication. They have a doctorate in psychology, whereas a psychiatrist goes to medical school and they prescribe medication. So you may encounter some people who have both. They have a psychologist who they go to for their therapies, and then they have a psychiatrist who prescribes them medication.
I got you. Come talk to me.
Well, you'll give me some of your medicine.
I ain't on no medicine. I'm on a pack.
You on the pack, salt pack.
If it come in the bottle, you don't medicate.
I ain't went and got it yet, so I don't know. I don't know yet.
I'll check up on you.
I go get it today. I will go get it today and take a picture of it and send it to you. You know I'm gonna add. Do I need to take this?
Yes.
All right, well, this has been a good one. I think we informed a lot of people on healthcare issues.
I enjoyed it. Thank you all for having me.
Me too.